Okay, well, welcome everybody. Good morning and welcome to today's media call with the Association of State and Territorial Health Officials. We're really glad to have you all here. Thank you for joining us. My name is Marcus Plescia. I'm the Chief Medical Officer at the Association of State and Territorial Health Officers that we generally refer to as ASTHO. And we're here to do a desk side briefing and talk to you a little bit about the upcoming respiratory disease season. And I would kick things off by just talking a little bit about this concept of a respiratory disease season. That's a little bit of a shift for us. We used to every year talk about flu and RSV and COVID and other things. And we've really realized that probably the more important messaging and the more important emphasis is that we're moving into a time of year when people are more likely to get sick. And there are precautions people can take and things that people can do to help us manage this season much better. I think this is a really important shift for public health. I think this idea of not focusing on specific diseases and things and thinking more broadly in categories that people can understand more easily is a really good direction for us to go. And what you're going to hear from our speakers today are some ideas of how we message with the public and what we want people to think about, and also some of the ways that state health departments are beginning to prepare for this upcoming season. You'll hear a number of sort of messages and precautions. The one thing I thought I would kick off with, which is a very, very important theme for us and something we really hope that we can convey to people as we move into the fall and winter season, is this message that there's lots of things you can do to keep from getting sick, but if you do get sick, please stay home when you're sick. That's a social norm we really want to advance going forward. We made some progress with that during the pandemic. You've got a group of speakers here who are all physicians, and I'll say physicians, sometimes we're the worst ones about that, stay home when you get sick. So, that's a social norm we really want to change, and something that I hope can be one of the themes of today's conversation. We are in National Immunization Month in August, so that's obviously something with the COVID vaccines coming out soon, something we really want to put an emphasis on. So with that said, I'm going to go ahead and introduce our speakers, and I'll turn it over to them, and we'll have a short presentation by each of the speakers, and then we'll come back and have a chance to take questions from all of you. So I'll introduce our speakers in the order that they're going to appear. First up will be Dr. Manisha Juthani, who is the commissioner of the Connecticut Department of Public Health. And Dr. Juthani also serves for and represents ASTHO on ACIP, the American Council of Immunization, the American Committee on Immunization Practices, which you all know is the important committee that helps make all these decisions and recommendations for us here in the United States. After Dr. Juthani, we'll have Dr. Samir Vohra, who's the director of the Illinois Department of Public Health. And then after Dr. Vohra, we'll have Dr. Kimberlee Wyche-Etheridge, who is ASTHO's Senior Vice President for Health Equity and Diversity Initiatives. So with that, let me go ahead and turn things over to Dr. Juthani.
Thank you very much, Dr. Plescia. Appreciate the opportunity to speak here today. And I'd like to take this opportunity to go over the recommendations for our three big viruses this respiratory viral season. So as we know, we usually have COVID, flu, and RSV circulating in higher numbers during the fall and winter months. So let's start with COVID. Since the pandemic has subsided and recommendations have been pretty consistent over the last couple of years, which is that if you are 6 months and older, a vaccine is recommended. Now, what I would say is that people may have skipped a shot or two over the last couple of years, and people may have had COVID over the last several months. But as we're going into this fall and then heading into the holidays, November and December, we really want to stay healthy and keep your families healthy and stay in the work setting and in school. And the best way to be able to do that is to be able to get vaccinated. So for everybody 6 months and older, a vaccine is recommended, and getting an updated vaccine this fall is what we would recommend for everybody 6 months and older. I want to lean into that point a little bit further, which is to say we do also know that the most number of people who are coming to the hospital are still people in older age groups. And so particularly for our older adults, we really want to recommend that you get that updated COVID shot going into this fall. Similarly, for influenza, we know that everybody 6 months and older is also eligible for a flu shot. You can get your flu and COVID shot at the same time. You can spread them out, whatever is going to be easier to make sure that you get it done. And that will also keep people in school, keep people at work, and reduce the amount of spread of disease that we have in our communities. Lastly, I want to turn to RSV. We know that last year was the first season where we were able to have RSV vaccines and monoclonal antibody available. And we had good uptake and we definitely saw an impact. But this season, we have a little bit more clarity from the ACIP in terms of who we know is going to benefit most, particularly for the adult population. What I want to say there is that everybody over the age of 75 should get an RSV vaccine. If you didn't get it last season, we have more than enough evidence to say that it is safe and that it is strongly recommended that you receive it. For people 65 and older, there is a list of medical conditions for which an RSV vaccine is recommended. And these recommendations are a little bit different than they were last season. But I do want to lean into the fact that for RSV, if you're 75 and older, please get that vaccine. If you're 65 and older, speak with your doctor about conditions you may have that make you eligible to receive a vaccine. And again, for the younger age groups, for pregnant women, you can get a vaccine during this season if you are pregnant. And then getting that monoclonal antibody for infants is going to be the way that we are going to be able to protect our youngest children and those infants from RSV, which is a time during which the impact of RSV can be greatest. So here in Connecticut, we are getting ready for respiratory viral season. We are excited for Immunizations Month and are showcasing all the immunizations that we have going into this fall. We know that some people did get COVID this summer. We did see a little rise in the number of cases, but it didn't have a significant impact in terms of hospitalizations and emergency room visits. What I would say to people is that if you want to get your vaccine as soon as it's available, you can certainly do that. But if you want to wait 3 months and get it closer to the holiday season, if you had COVID this summer, that is also fine. But it is perfectly fine to get all these vaccines at the same time. And I'd like to take an opportunity now to turn it over to my colleague, Dr. Vohra, for some thoughts from him.
Well, thanks so much, Dr. Juthani, and thanks so much, Dr. Plescia. Pleasure to be here from Chicago, Illinois, and provide a perspective about the fall respiratory season here in the Midwest. We've been fortunate similarly that although we've seen a summer surge in COVID cases, that surge has been pretty moderate. And what we've seen, though, is a very low level of hospitalizations from COVID. Currently, there are only 2% of our hospitalizations in the state are based on COVID illnesses. And as Dr. Plescia said, we here in Illinois are moving to describing a greater goal of keeping people safe from respiratory illnesses. And you heard from Dr. Juthani how we're emphasizing the goals of making sure that people are vaccinated from COVID, RSV, and the flu. But we know that vaccination rates have been dipping since the start of the COVID-19 pandemic. And we're also seeing a real concern as individuals across the country have moved away from feeling as if vaccines are as important as we know they should be. A recent Gallup poll showed that 40% of parents said it was extremely important for their children to get vaccinated. That's down from 58% in 2019 and down from 64% in 2001. When we combine parents thinking that this is extremely and very important, that percentage is only 69% today, and it was 94% in 2001. Now, I'm a general pediatrician by background, and in each and every one of my visits, I would talk about the critical importance of vaccines, building that rapport with my parents, and making sure that we answered many of the tough and challenging questions. We know that childhood vaccines come in many forms, and illnesses like Haemophilus influenza or tetanus, diphtheria, and pertussis aren't household names. But what we've seen and what we often say in the pediatric clinic and the public health community is that these childhood vaccinations have limited really serious illnesses. And it's a great thing that those illnesses aren't household names because we know that they're not affecting our youth. They're allowing us to enjoy the really important and meaningful childhood lives. And so that is an issue. How do we get back to a point where we are discussing and elevating the importance of vaccination so those illnesses don't come back and become a mainstay? Here in Illinois, earlier this year, we had our largest measles outbreak in nearly 30 years. Again, an emphasis about how important childhood vaccinations are. And so here in Illinois, we have put real efforts to making sure that we take the right and important public health approaches to elevating that important conversation about vaccines. One, in public health, we know how important information, data, and evidence is. And so Illinois has launched a brand new school vaccination dashboard. So individuals from every school district can find out and point to see what are the vaccines that don't meet those thresholds to get that important immunity for the community. Two, we know that public health is a team sport, and we've been working very closely with our partners in community, our local health departments, our state board of education, our partners in insurance, to elevate the important conversations and making sure that we answer tough and have the right conversations to make improvements in vaccine coverage. And finally, we are trying new and different communication messages to make sure that in the lots of information that comes, as we know, sometimes that information isn't as scientifically accurate or meaningful as we would like it, to bring new ways to get people to notice. And we were so proud last winter to launch our "'Tis the Sneezin' campaign during respiratory season to make sure that people understood the importance of being healthy, protecting those that are most compromised from getting sick, but how critical vaccinations are to making sure that every community in Illinois is as safe as possible. And so now I'll pass it on to Dr. Kim Wyche-Etheridge to discuss some other important topics.
Wonderful, and thank you. "'Tis sneezing." That's beautiful. I'm gonna have to use that one. I'm also a practicing pediatrician because honestly, pediatrics and public health have always been hand in hand. When we think about what's been happening with our immunizations, and Dr. Vohra mentioned the decrease in the rate, we've also seen a significant decrease in the rate. But the numbers don't tell the story. If you talk to parents, if you're in the clinic, you'll see that there's been a significant increase in the mistrust. And we know that there's been the distrust and mistrust after everything we've been through over the last couple of years. But we're really seeing it in the immunizations. Whereas before, when there is I'm going to say an institutional history, somebody has seen the effects of a child being hospitalized with a bad case of chickenpox. Somebody has seen what Haemophilus influenza looks like, or some of these other diseases. New family or grandparents with polio. There was a guttural response to, yes, I want to protect my child from that. Without that kind of history, then it becomes much more of a, it's okay. I don't need to get the child vaccinated. And so spending a lot of time in clinic talking to parents about the importance of vaccine. But my talking to parents, if they're an infant, 3-4 times for those 2, 4, 6 month visits versus what they're hearing 24/7 in media, in the news, on the computer, is just there's no competition. So we haven't been able to do a really good job at really countering the misinformation that is out there around vaccines. When I ask a parent, especially my teenagers, about vaccinations, they say, well, the TikTok doc said such and such, or this person. So where are our pediatric TikTok docs? We need some pediatric influencers that can give correct information. So we've seen these numbers going down. We've seen the distrust going up, and we've put together different campaigns about increasing access, increasing information. But what we haven't done successfully is to actually ask the community, to talk to folk about what are their fears, what is it that they're hearing, what are their concerns, so that we can address them in real time. And without that, it's very hard to achieve health equity and decrease some of the disparities we're seeing, because if you don't trust your provider, then you're not going to tell them what you're thinking, what you're feeling, or even your symptoms. So we really have to get back to a point where we can communicate, where we have the time to answer questions, and in the community, we can offer the correct information that patients need, that our families need, so that they can make the best decisions for their children, decreasing some of that fear, and also remind them of why we do what we do. And even though, as was said, these diseases are rare, they're deadly, or have major morbidity that we can really avoid at this point. So as far as vaccines and the health equity, we're not in the same markets as the people and where they're getting their information. We need to widen our message. We need to be a little bit more forward in the narrative about the importance of vaccines, and talk to the communities where they are and listen to them as far as how do we increase the immunization rates. We always say the community has all the answers to the questions. We just in public health forget to ask them, or don't ask them, don't bother to ask them. So changing how we do our public health immunizations will hopefully increase our rates, and we can see these nosedives that we saw after COVID in 2020 come back up to the rates of the 98, 99% vaccination rates, which will protect not just our children, but our seniors and our whole communities. And that's what public health is about. How do we protect our populations? And with that, I'll turn it back over to Dr. Plescia.
Great. Well, thank all of you for your comments there. And I'll just summarize a few things. I think we heard Dr. Juthani just give a little bit of an overview of the different vaccines that we have now, and some of the administration issues there. And then I think one of the things that Dr. Juthani really pushed up is this issue that we're particularly interested and concerned about vaccination among some of our older adults who are really where a lot of the risk is, and where I think a lot of the public health attention is going to shift. Dr. Juthani also mentioned the RSV vaccine, which, is such an incredible thing to have that vaccine. Many of you in the media know how long we've worked to try to develop an RSV vaccine, and it's a huge triumph that we have one now, and we hope people will really take advantage of that. Dr. Vohra talked about the fact that we're in a good place now with COVID. We're not seeing the same kind of hospitalizations and death, and that's a huge step forward. But we're very worried that our vaccination rates are dropping, and there just seems to be a little bit of some complacency there around the importance of getting vaccinated, and particularly of getting children vaccinated. And then Dr. Wyche-Etheridge talked a little bit about the fact that the numbers don't tell the whole story, and this issue of trust is so important, particularly in some of our more disparate communities, and really thinking about who the messenger is and how we can reach everybody and really try to help everybody have good information about vaccination and other issues related to the respiratory disease season. So with that, we're going to go ahead and open things up so that you all can ask questions. What we'd like to do is ask you to use the hand raise option in Zoom, and then we'll call on you in the order that you raise your hand. So the floor is now open for questions from the media. Good. I see Fennett. Narapil's got his hand up, so Fennett.
Hi, thank you for doing this. Last vaccine season, we saw a lot of people running into insurance challenges trying to get the COVID vaccine. Part of it was insurers apparently not adjusting their billing codes and everything, but other parts were insurers were grandfathered in and not required to cover vaccines, or pharmacies being out of network. Do you have any guidance for people on what to do if they're encountering these kind of insurance challenges, especially now that the Bridge Access Program is over and that was a stopgap for these situations?
Yeah, let me head that over to maybe to start with to Dr. Juthani, sort of hear a little bit about how they're trying to handle that in Connecticut.
Yes, thank you for that question. And, I think this was a real challenge last season, moving from federal disbursement of vaccine to commercialization of the vaccine. And so what we're hoping is that this time around, many of those issues will have been sorted through. Again, we in public health do not have eyes always on all of the commercialization and access that may be out there. And the CDC does have a pharmacy search tool to be able to find out where there may be vaccine available. As you mentioned, the Bridge program, which did help to cover uninsured adults, is no longer in effect. However, we still believe that there are access points through our federally qualified health centers and other mechanisms that already exist for routine medical care for those who are uninsured and underinsured. So this season, our hope is that with a number of those kinks having been worked out last season, that there will be a little bit more of a smooth rollout. And it is a challenge, unfortunately, for us in public health when we don't have the full eyes on the full spectrum of everything that's happening through the commercial process, but trying to connect people with usual sources and resources for medical access is what we're trying to lean into.
Right. Dr. Vohra, anything to add in that from your perspective in Illinois?
The only thing that I would add, and I think Dr. Juthani nailed it, of just having more reps now a year in. We know that it was a challenge last year, and that has been elevated in our state and across the country about the need to make sure that providers, insurance companies are more ready and willing to kind of meet this important need during the 2024 respiratory season. But it's also a place where, because what we have learned from the COVID-19 pandemic, that these sort of relationships and really places of connection between the commercial industry, governmental public health, insurance, healthcare providers, that we need and are leaning into being a full team around this, and even sort of taking the responsibility much more. And in our Illinois Department of Public Health has started a series of conversations with providers, hospital systems, to make sure that they know all of the public health information so we can make sure that they are most prepared as we enter the fall respiratory season.
Right, thanks. We've got a few more questions rolling in, so let me just move on to those. Michael Ehrman.
Hi, Mike Ehrman from Reuters. I'm just wondering whether the physicians on the call have any preference between the 3 approved RSV vaccines for older adults, and are there recommendations that you're making for your patients, or is it kind of whatever they have at the pharmacy?
Let's maybe start with Dr. Juthani, since she's on the ASIP and has some information about that, and then we'll go to our other 2 panelists too.
And I just want to clarify, you said specifically for RSV, or were you asking? Okay, so yeah, I mean, I think whatever is.
Yeah. And for older adults, not obviously just the Pfizer for pregnant people.
Right, exactly. I think whatever is available really is reasonable to go for. And I don't have any specific recommendation one way or another. And I think what is available, what's near you, is really sufficient for what I've seen. And, you know, as an infectious disease doctor and somebody who's looked at this stuff over the years, you know, RSV, we were so limited in the past. And so in terms of what we could do, really supportive care was the mantra I lived by for basically 20 years of taking care of patients with, you know, very limited other options. In terms of the vaccine, I don't see a lot of other changes. So really whatever you can get your hands on, I think is reasonable to take.
I think that's good guidance. Dr. Vohra, you have anything to add to that?
I absolutely agree. Just making sure that the vaccine that's available, you know, as we do know, the CDC did recently put out recommendations for the RSV vaccine for everyone age 75 and older and adults age 60 to 74 at increased risk of severe RSV. And that includes things like chronic heart or lung disease or other current medical conditions, those residents in nursing homes and long-term care facilities. And just also the, I think, very important point of that RSV at this moment is not an annual vaccine as recommended per the CDC, meaning that older adults do not need to get a dose every RSV season. And if you've gotten one already, it's not recommended that you need another one this year.
And Dr. Wyche-Etheridge, any thoughts on this?
Just to add to that, when we have multiple or several different versions of a vaccine that has been proven safe and has been used in different areas, that's information that we just need to share with the patients as far as why are we choosing this one versus that one. It may be availability, it may be storage, it may be whatever the reason, but to be able to be transparent and share that so that, again, they're hearing about all of these different vaccines and will then kind of raise an eyebrow about why are you giving me this one when someone else got something else. So being transparent and say, we at this clinic chose to use this vaccine because of blah, blah, blah. And then that helps to build that trust again. And also just a comment from Access is building it and expecting people to come is a kind of old for public health. Build it and provide the education and create the desire so that people will utilize it. We had in COVID, we had vaccine clinics in communities where there was a line, but the line was from people in other communities knowing that there was vaccine there and not for the community where it was situated, because that outreach had not been successful for the people that could have walked to that pharmacy. So changing that attitude of build it and they will come, but also the transparency.
Great, thanks. Next up, we have Caitlin Levinson.
Hi there, good morning. Thank you to the panelists and speakers. I'm a reporter with Route 50. We cover state and local government. And I'm especially curious about the data on vaccination rates. Dr. Vohra, I'd love to hear your thoughts as well as others on maybe the impact of having these dashboards, if they're more like, if you think families are more likely to make vaccination decisions based on those. And then similarly, have you guys noticed any efforts across states or jurisdictions to make that data easier or harder to access?
Can we start with Dr. Vohra?
Caitlin, it's a wonderful question. And I think partly we are trying to take into account some of the really important lessons we've learned from the COVID-19 pandemic that similar to Dr. Wyche-Etheridge's point, having the opportunity to have data available that is hyperlocal, it's meaningful to individuals so that they have the ability to pinpoint and make that information not just about the state or about the country, something that's very meaningful into their communities. And that was the goal for our school vaccination dashboard. But we do need to continue to find different, easier venues for people to be able to use that information, feel like it's necessary and it can be impactful. And so that's been a place where we have been trying to communicate it to their local providers. Of course, from the state end, we do our best to put out information, press releases, et cetera, and especially during our measles outbreak earlier this year, we did sort of amplify that this dashboard was out there. But that is the next step, right? And moving from just the fact that we have it is a good thing, but how do we make it more meaningful and in a way that sort of makes sense to them? And I think we put a lot of effort and thought into making it by school district, allowing people to understand, well, what does a 82% versus a 97% actually mean? And that means, where is the kind of threshold that would provide the community with that herd immunity so it wouldn't kind of move across? And it is or continues to be our goal to fine tune this dashboard, continue to learn from our community members so that it's not just something that is on our website, it's something that people are using to make the kind of decisions that they need to have healthier lives for themselves and their loved ones.
Any further thoughts on that, Dr. Juthani?
Yes, thank you. So we too have had a public-facing school dashboard for the last several years. And one of the things that we've seen in Connecticut, we're very fortunate that our vaccination rates, particularly at the kindergarten school entry level, are now higher than they were pre-pandemic. So like many states, we saw a dip during COVID, but through concerted efforts from public health, pediatricians, school nurses, communities, our rates now are higher than they were pre-pandemic. And the public can go on and see different schools throughout the state and what the rates are at the various different age points. So I think that this has been helpful because people in the community can see what's going on hyper-locally. In addition to that, we have worked with CDC partners to have teams go into communities where there have been lower vaccination rates and do an assessment of why is it that there may not be as high rates in this community. And a lot of times those reasons are very hyper-local. They might have very specific things that we may not realize just sitting in the state health department up in Hartford. And working with our local health departments and seeing what's happening in local communities has been able to help us overcome certain barriers with maybe specific concerns that have existed in specific communities, and then be able to deploy the appropriate resources to be able to help overcome maybe some of the misinformation, disinformation, or sometimes just lack of information. In certain immigrant communities, sometimes that has been the case. Making sure things are in the correct language to make sure we can communicate with a community in a language and in a language that makes sense to them, utilizing terms that can really meet people where they are at. And I think all of these efforts have helped enable us to get to the point where we are. You know, we so far in Connecticut have been fortunate that we have not had a measles case since 2021, but I've been very concerned that we might, because we do have certain areas where we are below that area, that level of herd immunity. And so, for example, one of the things we are leaning into is that if you have a 6 to 11-month-old who is traveling internationally, if they weren't traveling, they might not be eligible for a measles vaccine yet. But if they're traveling internationally, even to Europe, which many parents may not realize could pose as a risk for getting measles, we are leaning into the fact that a 6 to 11-month-old who's traveling internationally would be eligible to get a measles shot. This is not only about people having misinformation. It's about people maybe not having up-to-date information. We have many people who might be eager to get their child vaccinated. They just don't realize that they might be able to benefit from a vaccine if they are traveling internationally. So I think the school dashboard and all these various things that we're doing are helping us keep our community safe and really leaning into tried and true public health principles that we know work and just reaching communities where they're at.
Thanks. Dr. Wyche-Etheridge, you have anything you want to add?
When we think about our dashboards, I know that we had our dashboard back during COVID about the number of cases or so, and we had our immunization rates and the number of people that were immunized. But there was one healthcare system in my jurisdiction that then published kind of dashboard data on their ER visit rates and hospitalization rates by vaccine status. And that had much more of an effect than just the number of people that were vaccinated, because they were then able to take that data by, I believe, by zip code or by county, because it's very regional, and really show that this group that was not vaccinated was X times more likely to end up in the ER and be admitted. And that tended to have a much stronger effect than just a dashboard showing how many people were immunized.
Great, thanks. I see we have a question from Sarah Miller.
Hi, thank you. Sarah Miller, NBC News. Thank you so much for doing this. My question is about the COVID vaccines. So I know that we're expecting the updated vaccines to be available in the coming weeks. So my question is, I know we're seeing really high COVID cases right now. Do you have any recommendations in terms of the timing of when people should get their COVID vaccination? Should people get it right when those shots are available? Should people try to wait a little, maybe get the shots later so that they have more protection, a little later into the winter if we're expecting a bigger winter wave?
Let me start with Dr. Juthani on this one, because I know this is a question she's been asking a lot and she has some ideas. So over to you.
Yes, thank you for that question, Sarah, because I think it's a really practical question people are struggling with right now. We've seen a lot of COVID in the community this summer. Some people have known they've had it. Some people don't know they've had it. And so what I would say is that if you feel strongly that you really want to get the shot as soon as it's available, even if you had COVID this summer, then of course you can get that. There's no nothing to say that you can't, in September or October. However, we also do know that over time, immunity does wane from having had COVID or getting the vaccine. So my thought on this is that if you don't feel strongly about getting the vaccine right away, then waiting about 3 months from when you had COVID, and particularly so that as we're approaching the holidays, that you get that shot before the big holidays and when you may be gathering with people. For some people, maybe that's Halloween. For some people, for example, in my cultural tradition, there is Diwali as a holiday. Thanksgiving, that's an all-American holiday. You've got Christmas, you've got Kwanzaa, you've got Hanukkah, you've got a number of different events that are going to be happening as we go into the fall and winter. And I think getting the shot certainly before you are having those big gatherings, if you had COVID this summer, I think is the most practical guidance. So again, if you feel strongly like you really want to get the shot as soon as it's available, there's no downside to getting it earlier. But if you are looking to sustain your immunity through the season with the updated shot to the best that you can, my recommendation would be to wait about 3 months and make sure to get it. If that's 2 months and you have a big holiday coming up, I think that's fine too. But basically, get it before the big gatherings that are going to be happening this fall and winter season to help carry you through the rest of the season.
Thanks. I think that's fairly consistent where most of us stand, but Dr. Vohra, Dr. Wyche-Etheridge, anything to add or sort of other approaches that you recommend for people?
Well, always to hear from Dr. Juthani, as someone that really respect, the way that she thinks about these critical issues. I think the only thing that I would elevate is that we do know that those that are over 65, those that are immunocompromised, those that with severe medical conditions are still at greater risk of getting severe infection. And it is really important, I think, for those individuals to, if able, meet with their healthcare provider to sort of think through the appropriate plan that makes the most sense to them. Being at most risk now and even later in the respiratory season it's a critical group of individuals that would recommend that they do think through their plan for the fall respiratory season with their provider to, one, ensure that they're getting a vaccination whatever time interval that makes the most sense, and they're doing it based on the clinical considerations that they themselves and their local provider have been thinking through for their own medical conditions.
Just to add to that is just being able to maximize on opportunities for especially for our kids or our teens who may be coming into the clinic because they need a fall sports physical or et cetera, to be able to have that conversation and offer the vaccine, because they're much more likely to get it in the clinic than to go someplace else and get the vaccine. But also having that conversation about the multi-generational households and understanding it may not be you that gets sick, but it may be grandma, it might be the infant, it might be somebody else that you want to help protect. So not missing opportunities because people are already in clinic to offer the vaccines, all of the vaccines, and hopefully get people protected before it gets too bad out there.
Great, thank you. And so, Fennett, I see you have your hand up again.
If no one else is going to be asking questions, I'll sneak in again.
Yeah, please do.
Following up with my theme of access, my last question, we also heard a lot of people really struggling to get COVID vaccines for their kids because a lot of pediatricians weren't stocking them. Pharmacies don't administer it for small kids. So any guidance you would offer for parents who are trying to find vaccines for their children this fall? And then I have another one for that after you address this one.
Okay, good. Dr. Vohra, you want to start with that one?
Yeah, and I think it sort of meets back to the earlier question around the challenges that have come through during the commercialization of the process. I think, one, twofold. Partly, as we are really, and as Dr. Wyche-Etheridge mentioned, into back to school season, people have recently come in or continue to come in for those physicals to just sort of plant that flag with the provider about what is their expectation of getting COVID-19 vaccination. So there is a conversation and plan moving forward, and partly as these things are often in a place that are local into communities, understanding that. But also that many of our states across the nation have robust vaccine for children programs, and really critical place to be able to provide this critical immunization. And that is a resource that continues to be elevated here in Illinois, and I know other states, to ensure the availability for people who qualify for that program. Many of those individuals and families in most need to be able to get COVID-19 vaccination.
Great, thanks. Dr. Juthani?
So in Connecticut, which is what I can speak of about best, we have a vaccines for children program and a Connecticut vaccine program, which makes for a universal vaccine program for children. And that means that, the state purchases them, pediatricians order them from us. And so one of the challenges, again, with the last year's problem and going from COVID in a federal response to sort of routine business, is that the way that providers were ordering vaccines was a separate track than their usual ordering pattern. And so we had to really get pediatricians on board to order COVID vaccines. There were other places people could go. All of that is done. It is one simple, streamlined process. COVID vaccines are like any other vaccine for a pediatrician, any sort of provider in the state of Connecticut. And so they order them the same way they would any other one. And they don't have to worry about the challenges on cost and other things that come up with vaccines in terms of as a provider that's administering them. So we think that this transition will actually be much easier for the pediatric populations and for children. I think the bigger challenge there is still in connecting people with the information, with providers being able to talk to parents about the benefits of the COVID vaccine, but availability should really, I hope and believe now, with the changes that have occurred over the last year, be much less of an issue, at least in the state of Connecticut.
Dr. Wyche-Etheridge.
Nothing to add on that. Just besides if our local health or state health officials show where we can access vaccine for families that may not be able to get it in their office, then that information is very helpful.
Great, thanks. And Bennett, I think you said you had a follow-on question?
Yeah, so having covered COVID vaccines for years, the two things I've been trying to reconcile is we often hear that the protection against hospitalization and death is more robust than the protection against infection for people who are vaccinated. We also hear that the immunity wanes over time. So how should a person look at their risk of getting a severe COVID case if they don't get the updated shot? Is it a type of thing that it's like your past immunity, your past shots and infection practically offer you no protection anymore? Or is it you're at low risk thanks to the immunity that you have, but your risk would be even lower if you get this next shot?
That's a tough technical question that we may not know the answer to, but I'll let Dr. Juthani maybe start this one off.
Thanks for that, Marcus. No, I do actually have some thoughts on that. I think it's a very reasonable question, Bennett. I mean, my thoughts are this. We know that vaccination, we know that exposure to COVID in the community provides immunity. And I think whether you know it or not, you likely have had some exposure to COVID over the last many months, years, or whenever it was since you last had a shot. So there likely is some immunity that you have. Having said that, we know that your immunity is going to go down. It is going to wane. And we think, again, based on what we're seeing in terms of the severity of the number of hospitalizations and emergency department visits we have now versus at the beginning of the pandemic, that is a reflection of sort of communal immunity that we have, because those have gone down. So it would not be realistic to say there's no immunity. There is immunity. There is most certainly immunity in the population at large from all the exposure and all the vaccines people have had. But on the individual level, there is still a benefit to getting an updated vaccine. And I would give just some anecdotal evidence from people and friends who I have who have said to me, you know, I got COVID this summer and it was really bad compared to the way I got it before. I had fevers and shakes and I was a lot more sick. And, you know, just sort of asked them like, well, when was the last shot that you got? Oh, maybe 2 years ago or something. Well, maybe, I can't say for sure, but it could be that maybe part of the severity of the infection they got this time is because their immunity maybe did go down a little bit. And so I think just sort of the way I think of it is a health maintenance situation, that you're entering respiratory viral you're entering respiratory viral season. We think about all the preventative health stuff that we can do as you're getting older. Maybe you're thinking about a colonoscopy or a mammogram, and you're thinking about all the other preventative things that you can do to stay healthy. Entering respiratory viral disease season, you want to make sure you can take your vacation. You want to keep your kids in school. You want to stay maybe in school or going to work, and you don't want to be laid up in a bed for a long period of time. Getting these shots are probably the easiest way to say that the amount of time that you're going to be out of commission is probably going to be less if you boost your immunity, even if you do get infected. So I think of it as a health maintenance sort of mechanism, and just sort of getting in the habit of doing those things that you know is going to keep yourself and your family as safe as possible going into this season.
Anything you want to add, Dr. Vohra?
And I love this analogy, and all of you are here to talk to people in public health and how much we value and our communication to the general public, valuing that prevention piece. Often the conversation comes much later when people are really sick, but the prevention piece is critical here. And we do know, and as I kind of started in some of my opening remarks, that we're fortunate here in Illinois to have a very different level of serious illness from COVID-19. That's a good thing. That's a thing we all are celebrating. But making sure that you do take all of that preventative measures, those tools that we are fortunate to have now, both being able to get that vaccination, but also the importance of those antivirals if you test positive and you are at risk, so that your symptoms are minimal, taking that Paxlovid between 5 to 7 days after you start having symptoms. Those are critically important tools that we should all be using. That makes our community, ourselves, our loved ones, our communities healthier. And so let's celebrate the fact that we're in a different place with greater immunity, but also recognize that these tools are still there for us to continue to be healthier, safer, and do the things that we want to do throughout this winter and celebrate those wonderful holidays that Dr. Juthani mentioned earlier.
Dr. Wyche-Etheridge.
Just adding, also having people to really evaluate their own personal risk. I spent a lot of time talking to my college age patients about their potential exposure to COVID, being on campus and being in large groups of people in dorms, or also to my athletes who are going to be having people breathing in their face on the basketball court, or in the band where you're spewing COVID out of your trumpet or whatever. But just being able to understand what your risk is. And if you have a high risk as far as just, I'll call it lifestyle, and your last shot was 2 years ago, you know, you kind of have to think about whether or not your immune system is going to be able to handle the extra stress that it's going to get from potential constant exposure from different people with different strains coming from different areas. So it just also helps with that educational component about what is your risk based on your particular lifestyle.
Yeah, and I'm going to add one thing to this. You know, we're in a very different place with COVID, where, you know, it's no longer this novel infection that people are getting very sick from, because we all have some immunity. But the reason we're shifting and really focusing now on the respiratory disease season and not just on COVID is the big concern we have in public health right now is if we had a point where there was a big surge of COVID, there was a lot of flu, and there was a lot of RSV, we could really get in trouble, because there are enough people, if there were enough people with all those things getting severely ill, even if it's a small proportion, we could get to a place where, you know, there might not be room in hospitals for people. That's the kind of horrific scenario we want to avoid. And that's why we really want to urge the public. This is where everybody's just got to chip in, do your part, get vaccinated, you know, so that we know we've got that security that we're not going to get into a bad situation where a lot of people are sick and we don't have somewhere for them to go. So let me see, anybody else have any questions? I might have one I would pose to the group, but I want to give our partners in the media a chance here. Raise your hand if you do. Okay, well, I have one thing I'd like to ask our panelists about, and I'm going to start with Dr. Wyche-Etheridge. So, you know, we've talked a lot about, it's just a great thing that it's so easy to go to a pharmacy and get these vaccines now. And that's just, I want to really say how great it has been that pharmacies have stepped up and offered this. But, you know, is there still a role for physicians? What do we need from doctors and doctors' offices when it comes to vaccine, and particularly for Dr. Juthani and Dr. Vohra? You know, what are you talking to your physicians in your states about? What are you urging them to do as far as their role in vaccination and why their role is so important? But let me start with Dr. Wyche-Etheridge, because I know there's a disparity issue here, and, you know, doctors can make a big difference there. Let me hear your thoughts on that.
Definitely. I think that preventive health is the key. And prevention means that you have a long-term relationship with your provider. And that long-term relationships allows you that time to build the trust, to get the questions answered. And if your doctor says, hey, I really recommend that you do A, B, or C, let's talk about it. that you get that information from someone that has been caring for your children for years. And in that sense, we can have that conversation. It is wonderful to have the convenience to be able to go to your local drugstore, if there is one in your community, to be able to get those services. A lot of communities aren't blessed with having a box pharmacy, and then whether or not there may not be the income level or whatever to have them. There's a box chain that just closed in my neighborhood for our local pharmacy. So that's going to decrease access there. But the long-term trusted relationship is key to helping with the access, but also with the decrease in the disparities. Because again, if we explain why we're giving this particular vaccine, why it's important, how we're protecting, and what are the possibilities for not being vaccinated or being around someone else that's not vaccinated, then that's a discussion that I can have on a one-on-one basis with my patients. And that can make a lot of difference. And at the end, I have a lot of patients that will say, okay, I wasn't going to, but based on our conversation, I will. And especially with flu vaccine, COVID too, but actually all the vaccines, just having that relationship. So I think that we hold a very special role in the longitudinal health of the population, which you can't always get in a drive-by or a stop-in pharmacy situation. So I think our role is to really be those advocates, to be those ears, to listen and understand the concerns of the community, understand where some of that misinformation is coming from, and be able to counter some of it, to allay some of the fears and some of those barriers, and make sure that we are able to provide the access that's needed. I think that is our role, and that's probably why a lot of us went into medicine in the first place.
Great. We're coming up on the top of the hour, so Dr. Vohra, Dr. Juthani, anything you're sort of urging your docs and your states to do, or has Dr. Wyche-Etheridge kind of covered it? But I want to open it up for if either of you want to comment on this issue.
Maybe I'll just say briefly that, we recognize in our state that most adults are getting their vaccines in the pharmacy. And, the Vaccines for Adults program has been in the president's budget. We don't have that right now. So for adult providers, the ease and that discussion and maybe being able to give the vaccine right in the office that happens for pediatricians is sometimes more challenging in the adult population because of some of those issues. So we continue to work on that in the state and try to see if we can get around that. But most definitely, a trusted provider is the most common way that people are going to be open to hearing about doing something that maybe they're on the fence about. And so certainly leaning into having our providers provide that counsel as well.
Great. Well, thank you. I'm going to go ahead and wrap things up. Samir, Dr. Vohra, did you have anything you were?
Nothing to just say. I think the more options we have, the better to get these meaningful things out there. But creating bonds of trust is a critical aspect. And so continued communications and that linkages between the public health and the healthcare communities is critical. So Dr. Plescia, I'll just pass it back to you to close.
Great, thanks. Sorry, we're getting a little tight on time. So thank you all for joining. Thank you, our panelists, for great presentations and particularly that perspective from what's going on at the state and community level. I just was going to close by saying the host for this newscast is the Association of State and Territorial Health Officials, and as you all know, we are the membership organization for state public health agencies and work to really support them in their efforts to implement and take on some of these challenges. I was going to mention ASTHO really is very much behind and wanting to support some of the vision around this approach to a respiratory disease season and how we address that. And actually ASTHO has convened sort of all of the national organizations who work in public health departments with a respiratory disease work group. So, we're taking our lead from CDC and the federal government on this, but the work group has come together to really kind of go back to CDC and others and really let them know what we need to be able to do this and do this effectively. Dr. Juthani serves on that work group, and I think it's just something that we're hoping we can do on our end to really help this be an effective approach. So we are at 12 o'clock. Thank you, everybody. If you do have additional questions that did not get answered, or you just didn't get a chance to chime in, you can send your requests to media@astho.org, or you can just give us a call. You know how to reach us. So again, thanks, everybody, and we really appreciate this opportunity to talk about the upcoming respiratory disease season.
Thank you for hosting us, ASTHO.
Thank you.